Back. The vast majority of breakthrough cases discovered in vaccinated healthcare workers are mild. That's according to the Johnson & Johnson's eNCA study investigators. The study shows only 2% of vaccinated healthcare workers go on to get a severe case of COVID-19. 94% of breakthrough infections are mild. A positive COVID-19 test more than 28 days after vaccination is considered a breakthrough infection. About 500,000 healthcare workers got the jab during the Phase 3B eNCA trial. Our specialist in health economics and finance from the Wits School of Governance, Professor Alex van den Heever, joins me now to discuss the vaccine rollout. Very good evening to you, Professor, and thank you so much for your time. There's obviously a concern from general South Africans that the vaccine rollout is not happening at the pace that it should be. How fast exactly should it be happening?
Well, the pace is picking up, but the problem is we're starting very late in the day. So we've had about approximately just over 3 million vaccine doses as of yesterday. And, in a country of 60 million people, that's not really good progress. 3 million people has addressed a number of the high-risk groups, which is important. But the people with the Pfizer dose have only had a single dose, and the people who received the Johnson & Johnson, the frontline healthcare workers, supposedly only require a single dose. But we're moving toward a position where we might have to provide booster doses for everybody who received Johnson & Johnson. So we're well behind.
Are we perhaps, as South Africans, not understanding the challenges that our government is facing in ensuring that they get these vaccines quickly enough and that they get people jabbed quickly enough? Or is this a matter of that our concerns are valid and that the government is, in fact, not effective?
Well, I think that government started very late in the day. What they began doing from round about the 4th of January was getting serious about a vaccine strategy, and they hadn't really been totally serious during 2020. And what that meant was that they ended up being at the back of the queue when they went into bilateral negotiations, when prior to that they were indicating that they were going to rely on the COVAX program, which at this point in time hasn't delivered a single vaccine to South Africa. So we would have been in real trouble if we'd carried on with the 2020 strategy. But I think a lot of pressure has been put on government to get their act together. It's also been a problem that they didn't roll out with the AstraZeneca vaccine in February, as they should have. And it would have made a lot of sense for them to have the eNCA expanded trial with Johnson & Johnson together with the rollout of several million AstraZeneca doses, which they probably would have had access to if they'd begun then. We would have at least had those vaccines into people prior to the winter wave that was predicted by everybody. So the beginning of the program now with high-risk groups has really been very late in the day when we knew we were going to face this problem.
Okay, so we know that they didn't do things the way they should. The problems have been identified, but now we need solutions. We are in the middle of a third wave, and it seems a lot worse than all the first two waves that we've been through, of course, especially where Gauteng is concerned with numbers sitting at close to 13,000 infections. What does the government do now going forward to ensure that this third wave does not get out of hand?
Well, I think it is out of hand at this point. The vaccine strategy is not actually going to impact on this wave. It could potentially impact on the next one. We're going to have to use non-pharmaceutical interventions to manage this wave to a better level. I think that there's no sign yet that we're seeing a significant turn in the Gauteng epidemic, although there might be some numbers which are starting to show a positive direction, but overall it could get worse before it gets better. But it's at a very, very bad position now, and the problem is with this kind of exponential increase is that a lot of the severe illness and deaths follow with a lag. And while we're on a rise, there's a lot more in the storm coming, which is very worrying. Within the rest of the country, we don't know which level they're going to achieve in, for instance, the Western Cape, which does appear to be rising quite significantly. But it did have a lot more, as a proportion of the population, it had a lot more infections than Gauteng in the past. So one can only hope that there's some level of immunity, at least against severe illness, in Western Cape, in Eastern Cape, and in KwaZulu-Natal, where the sort of largest populations are concentrated. But there's a lot of uncertainty that we will experience in the next 2 weeks.
Professor, just over 120,000 jabs administered in just the last 24 hours. What kinds of numbers should we be looking at daily in terms of jabs?
So I think that that's very good. We are achieving that with by getting scale, and because we have a good stock of vaccine doses available because we were very delayed in starting. So we have acquired a lot of doses, and we didn't administer the 5 million doses to the end of June that we were going to. So we've only administered 3 million. So at least out of the doses that were part of the rollout, only about 2.2 million. So it's a significant surplus. So that's not the constraint now. We've got constraints in that the public sector is not vaccinating over the weekends, and they've got to get that going. And we've got to get up to about 300,000 a day. And then I think that we're at a scale that's reflective of the kind of approach we should have, 300 plus a day. Vaccinations are relatively straightforward intervention, and they can be extrapolated and expanded at the margin quite rapidly as we get more doses. And there's lots of settings where we can vaccinate from. So I think we can really get going, and it's a good sign that we're getting over the 100,000 per day.
Professor, thank you so much for your time this evening. That is Professor Alex van den Heever, of course, who is a specialist in health economics and finance from the Wits School of Governance.